Medicare Part D prices are going down, down, down. If you watch the media, it says that this administration has done everything for seniors to drive down the cost of prescription drugs. And I will say that they have made a lot of efforts in that direction. And on paper, it looks good. And the headlines, it looks good. But when you read your policy, it does not look good. Prices went up tremendously last year. People were very shocked by that. But they said, well, inflation this year will be worse, much worse, double and triple worse than last year. And by this year, I mean starting in January of 2025. So when you have your annual notice of change, you'll receive in the mail in September. Most people just throw it out. The notice of change says this is what your drug benefit looks like for 2024. This is how it will change for 2025. Read it, because you might need to change your plan. We're estimating that 70% of retirees will change their plan this year. That is because the list of drugs that every company covers, this is called their formulary, and it might be very big. We cover tons and tons of drugs. That list is going to get smaller this year so the company can save money. The copays that you pay are going to go up so the company can save money. And they're going to make a lot more difficulties for you to get your drugs. They're going to say, oh, you want that drug? Your doctor has to request prior authorization and go through this process, or you have to go through step therapy. You have to go through these different hurdles before we're going to give you that drug. We're happy to give you that drug. It is on our list of drugs, but you got to go do a little work. Those barriers to entry will be increased for 2025. All these things are to help the drug companies save money. And of course, your premium, that's the easy thing. You might have been paying $5 last year. Expect it to double or triple or worse in 2025. Now, why are the drug companies doing all these things? Because in 2025, the government is limiting how much you can pay out of pocket to $2,000. You're like, I don't pay $2,000 anyway. Well, if you're the person that doesn't take very many drugs, you are subsidizing now the people that take over $2,000 a year in drugs. So everybody's paying more in premium, in deductible, in copays, so that you can subsidize the few people that take a tremendous amount of drugs, those people that would normally pay over $2,000 a year. So if you are that person that pays over $2,000 a year, this is a win for you. Yes, things are going to go up, but overall you're going to save thousands and thousands of dollars because you are limited by the Inflation Reduction Act to only paying $2,000, not in your premium. So they can get you on the premium in your copays. In your copays that can't exceed $2,000. So that is a win for you, the few. But for the majority of us, we are going to pay a lot more. And it's really going to hurt the people that don't take any drugs. You're like, I'm healthy, I don't take anything. My mother-in-law is 92 on no prescription drugs. Does she have a Part D drug plan? Of course, I'm a good daughter-in-law. Because you don't know if around the corner she's going to get something very expensive. And she's going to need the drug insurance. So she's paying for a plan that she doesn't use, which I always tell people, be happy to have it and not use it. That means you're healthy. But she's going to be a lot less happy. If she was paying $5 a month for it last year and not using it, that's okay. But if she's paying $50 a month for it in 2025 and not using it, she's not going to be as happy. She's going to be a lot more likely to say, I don't use it, and get rid of it. And that is dangerous because you never know, right around the corner, you're going to get some chronic condition with outrageously expensive drugs. If you don't know what some of these drugs cost, I had no idea. Some of these drugs cost $13,000 a month or more. You can Google it. It's horrible. It's horrible. So in the case that you get one of these conditions where you have to take these outrageous drugs, MS, rheumatoid arthritis, Parkinson's, some of these osteoporosis drugs, of course, cancer drugs, so expensive, you are going to need the help from the insurance company, and they're going to limit you. They're only going to let you pay $2,000. But if you were the person that said, I don't need it, and you canceled your Part D plan, and then you get your diagnosis and you need help with the drugs, you're in trouble until the next time, the next part of the year, when we can get you back into the Part D drug plan, because they can always get you back in. You might have to wait a year. And you will pay a late penalty for having been out for as many years as you were out. You'll pay that lifetime penalty. So my point here is Part D is going to look ugly. It's going to cost a lot more. Even if you're not using it, You still should be in the program because that's what insurance is for. It's for the what if that could happen down the road. Hope this didn't upset you too much. Just trying to keep you up to date on what's actually happening with the Inflation Reduction Act. It's going to help some people, but most of us are going to pay a lot more. If you learned something, please give me a subscribe.
If you like this video, you might really like this video. Check it out. And we'd appreciate if you subscribe to our channel so you never miss a great video. We put out one every week. Check in the description below this video for a link to our cheat sheet on Social Security and Medicare. And you can also give us a comment if you have a specific question. Always feel free to call us or email us at the Medicare Family.